Have you ever felt like your body is trying to tell you something, but the message is just a little too strange to understand? As we grow older, the signs our bodies send us become more subtle, more peculiar, and often easier to ignore. One of the organs most skilled at silently signaling distress is the liver. This incredible organ works around the clock, acting as a filter, a processor, and a powerhouse for our overall health. Yet when something starts to go wrong, it rarely sends obvious alarms. Instead, it whispers its warnings through unusual symptoms, of which might seem unrelated or downright bizarre at first glance. The liver is often compared to a chemical processing plant. It handles everything you eat, drink, breathe, or absorb through your skin. It filters out toxins, helps digest your food, balances hormones, and supports your immune system. But when it becomes stressed or damaged, it may no longer perform these tasks efficiently. And that's when the subtle, sometimes confusing signs begin to show up. One of the most recognizable, yet easily dismissed, signs is jaundice. This happens when the skin or the whites of your eyes start to look yellowish. It's not just a cosmetic issue, it's the result of a compound called bilirubin building up in the body. The liver usually filters bilirubin out, but when it's under stress or malfunctioning, this filtering process slows down. The result is a visible yellow tinge that should never be ignored, as it may be the body's way of signaling liver stress or early damage. Dark urine is another unexpected clue. While it's true that certain foods or dehydration can affect urine color, a consistently dark, almost brownish hue might suggest a more serious issue. When the liver is struggling, it offloads extra bilirubin into the urine, turning it darker than normal. If you notice your urine color changing, and it doesn't seem linked to something you've eaten or your hydration level, it may be time to take notice. Your digestive system also reflects the state of your liver, particularly through the color of your stool. A healthy liver releases bile, which gives stool its typical brown color. But if the liver isn't producing enough bile, if bile ducts are blocked, your stool may appear pale, gray, or even clay-colored. These color changes are subtle but significant. They signal that your liver's communication with the digestive system may be interrupted, which could be a result of inflammation, obstruction, or other liver-related issues. You might not think your ankles and legs have much to do with liver function, but swelling in these areas can be another sign. The liver produces a protein called albumin that helps maintain the balance of fluids in your blood vessels. When albumin levels drop due to liver dysfunction, fluid can leak into surrounding tissues, especially in the lower body. This condition, known as edema, can be uncomfortable and even painful. Sometimes it extends to the abdomen, causing a buildup of fluid known as ascites. Swelling like this, particularly if it appears without an obvious cause, deserves attention. Fatigue is a symptom that often gets chalked up to age or lifestyle, but it can also be a clear indication that your liver isn't operating at full capacity. The liver is essential to energy production, nutrient processing, and toxin elimination. When it's not functioning properly, the body accumulates waste and lacks sufficient energy, leading to ongoing tiredness and weakness. If you feel run down even after a good night's sleep or start to experience weakness that interferes with daily activities, it may not just be aging, it could be your liver asking for help. Another strange, often ignored symptom is itchy skin. While dryness or allergies can cause itchiness, liver-related itching tends to be more persistent and harder to soothe. When the liver can't process toxins effectively, some of these toxins end up depositing in the skin, causing an irritating itch. This discomfort can be widespread and tends to worsen at night. If lotions don't bring relief, and there's no clear explanation, liver function might be the underlying issue. The liver's role in digestion also affects how you feel after meals. Nausea and vomiting aren't just signs of a stomach bug, they can indicate that your liver is not producing enough bile, or that bile isn't flowing as it should. Without sufficient bile, the digestion of fats is impaired, and undigested food may cause discomfort or even vomiting. If you notice that nausea sets in more often after eating, especially after fatty meals, it could be a quiet cry from your liver for attention. Loss of appetite often follows. As bile production decreases and toxins accumulate, the body becomes less inclined to process food. Fatty foods in particular may seem unappealing. This reduced appetite can lead to weight loss, without trying, and even malnutrition over time. It's easy to brush off as just not feeling hungry, but in the context of other symptoms, it paints a clearer picture. Chronic fatigue is not just tiredness, it's a persistent, unrelenting exhaustion that doesn't improve with rest. When the liver is overburdened, its role in metabolism falters. The energy you used to rely on feels like it's disappeared, leaving you drained without explanation. This isn't a mood issue, and it's not about laziness, it's a biological response to internal imbalance, especially in the liver. Perhaps the most surprising signal is bruising easily. The liver helps produce proteins that allow your blood to clot. When those proteins are in short supply, even a slight bump or scrape can leave a significant bruise. Healing slows down, and you may find yourself wondering how you got bruises you don't even remember earning. It's easy to blame medications or thin skin, but the liver plays a central role in this process, and bruising can be one of its subtle distress signals. Another visual symptom is the appearance of spider angiomas. These tiny, spidery red veins tend to show up on the face, neck, or chest and look like little bursts of blood vessels just under the skin. They're linked to elevated estrogen levels, which the liver normally helps regulate. When liver function declines, hormone levels can fluctuate, leading to the formation of these visible veins. Lastly, frequent nosebleeds or bleeding gums can also stem from the same clotting issues mentioned earlier. When your body can't form clots properly, bleeding becomes more frequent and harder to stop. Nosebleeds might appear without warning, and your gums may bleed more than usual when brushing or flossing. These signs are easy to ignore, or chalk up to brushing too hard. But they can signal deeper trouble, especially if they come with other changes. All these symptoms in their own might not seem like much, but together they tell a story. A story about an organ working overtime, quietly signaling that something isn't right. The liver rarely makes a loud announcement. Instead, it speaks through the body's subtleties, encouraging us to listen closely and act early. Our bodies are always working to maintain balance and health, but they need our attention, especially as we grow older. Too often, we treat the signs as separate events, a little fatigue here, a bit of itching there. But when we understand how interconnected these symptoms are, we can take meaningful steps toward protecting our health. It's easy to think that serious issues start with pain or dramatic symptoms. But with the liver, the story is different. The earlier you notice and respond to the signals, the better your chances of reversing or managing any potential damage. Liver health isn't about waiting for crisis. It's about staying informed, staying vigilant, and recognizing when your body is speaking, however softly. And the good news? Many of the things that support liver health also support overall wellness. Drinking enough water, eating balanced meals, rich in leafy greens, whole grains, and healthy fats, cutting back on alcohol and processed foods, and moving your body every day. All of these steps strengthen your liver and your entire system. Taking care of your liver isn't a chore, it's a gift to yourself, one that pays off in energy, vitality, and peace of mind. So, if any of these symptoms sound familiar, take a moment to pause and reflect. Your body may be trying to get your attention. Listening now could make all the difference later. Aging well isn't just about what we avoid, it's about what we pay attention to, what we nurture, and how we respond to the quiet signals within.